Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
So, hi everyone. My name is Diana Ferreira. I'm a certified lifestyle medicine physician and I work in the oncology field. I hold a master's and a PhD in palliative care, and I'm also a lecturer at the European School of Lifestyle Oncology. And today I'm joined by Christopher Fitzmaurice. Chris is an exercise physiologist working at the University of Miami. He holds certifications through the American College of Sports Medicine as a clinical exercise physiologist and as a cancer exercise trainer. He's also a certified strength and conditioning coach through Strength and Conditioning Association and USA Weightlifting also as a coach. In addition, he holds certifications to the American Council on Exercise as a health coach and a group health instructor. He has 5 years experience of working with cancer survivors, and I'm thrilled to welcome Chris on the show. Welcome, Chris.
Thank you. It's an honor to be on here. Thank you.
So, I guess I would like to start by asking you, why is it important to talk about exercise and physical activity, for that matter, more often in health, but also in the context, or specifically in the context of cancer and cancer treatment?
Absolutely. I want to say definitely within the recent years, we're really understanding the true effectiveness, the true power, as I like to call it, of the benefits of exercise. We used to think that just exercise in general is just good for our health, which it is, but there is a multitude of benefits what exercise has to offer. Not just for us healthy people and individuals who are athletes of certain sports, but more specifically for the people that really need it, like people with at risk or have various chronic diseases, whether it's heart disease, diabetes, cancer. Obviously, we're learning more and more just the power of the preventative aspect of what exercise has for these given conditions, but also for the treatment aspect for these given conditions as well. And specifically in the context of cancer, we're really understanding of how different types of exercise and even different intensities of exercise, light versus moderate versus vigorous, offers the different level of benefits for cancer survivors, not just for what it does for them directly for their immune system, but also just what it does for their musculoskeletal system and their cardiovascular system, in response to the various cancer treatments out there. And I want to say we're just really just scratching the surface of just the true power of exercise for cancer survivors, and we're on our way to understanding just the true potential of what exercise can really, really deal for them as well.
Yeah, absolutely. And perhaps maybe 10 years ago, we wouldn't have been having this conversation, right? This is actually quite an evolving field. And yeah, it's brilliant what you're bringing. So, let's break down the role of exercising different stages of the cancer journey, because I think that's really interesting and important. You talked a little bit about prevention. I think prevention is obviously where we start, at least in lifestyle medicine. That's how we think of it. And it's prevention is actually such a broad concept, because you're not only preventing cancer with exercise, but you touched on, like, a person is very complex, and we're preventing cancer, but also we can be dealing with preventing obesity, we can be dealing with preventing diabetes. There's all these conditions that actually sometimes come together. So can you expand a little bit on that?
Oh, absolutely. Obesity, for one example, what you just brought on, I look at that as, just as how multifactorially linked of all the different aspects that it affects obesity. I want to say it has a similar effect on um, different cancers out there. I can't remember the exact number of cancers off of my head, but I know, for example, obesity, is a major risk factor for a variety of different cancers, especially breast cancer or the various gynecological cancers, GI cancers. So when we're talking about the preventative aspect of exercise, of course the aim is, yes, of course, prevent cancer risk, but we're trying to mitigate the issues that maybe that cause obesity, but then also even diabetes, because there's even a connection with diabetes in terms of insulin sensitivity and responses to the nature of cancer growth and progression as well. So it's almost in the aspect of, when we are trying to prevent the cancer, we're ultimately trying to prevent all these other issues that has a distinct connection to the growth of cancer itself. So it's one of those things like where it's like how they say we're trying to kill two birds with one stone. Basically, it's like, yes, we want to prevent obesity, or we want to prevent cancer, but we want to also prevent all these other factors as well. And this even the mental health proponent too. We know that depression, there's a strong link, just cardiovascular disease, and also just to the strength of our immune system as well. So just keeping in terms of our mental health strong or great with the effects of exercise has a big effect as well. So you have all these different variables in the preventative aspect of when you do exercise. You're ultimately preventing the risk of cancer itself.
Right. Yeah. So important. And um, I would like to ask you as well about this concept of a different stage, which is prehabilitation, which is something that people have been discussing in our field increasingly. And at least here, I mean, the experience we have in Portugal, people are very focused on rehab, post surgical rehab. And, but we're actually starting to discuss prehabilitation. And I was wondering if you have some insights on that.
Yes, absolutely. And prehab is a big interest of mine. I look at prehab being the leveraging tool for rehab. I mean, rehab ultimately has been around first of the first ways of helping the person to get better. But there's studies out there, when it comes to looking at the successes of rehab, this can be determined by the successes of prehabilitation as well. So depending on what the context is for the cancer survivor, whether it's maybe they're going through chemotherapy, maybe uh, more unfortunately, like surgery, one of those treatment aspects of it as well. But depending on what it is, the ability to do really good in the prehabilitational stage is going to help to have a strong determination of how successful post surgery or post treatment goes for the rehabilitational stage. And I really look at when we're talking about the aspect of cancer, or especially when it comes to the treatment, it's almost like prepping up for a marathon. So I don't know if you're an avid runner. I mean, I'll be honest, I'm not an avid runner myself too. I love the exercise, but when it comes to that long distance stuff, um, I don't do it. But I do know in preparation for that, there's a lot of pre work that you have to do to prepare for an arduous, exhaustive event like that. So switching over to rehabilitation, you know, um, of course, dependent on the cancer treatment itself or the strategy itself, prehab can make a big, big, big difference. Not just the ability to deal with the treatment aspects of it or the side effects, but also the recovery rate as well. I look at it as our bodies is like a castle. It's a castle, and, when we go through the cancer treatments, or when there's the cancer treatments, the castle is taking the blows from the enemy, back in the medieval times. But then, you know, um, upon those damaging blows, the castle needs to fix itself. Well, a fortified castle is going to have the ability to fix itself even better, as opposed to a non-fortified castle, you know. Um, the so when it comes to the recovery aspect of it, the better we can fortify our bodies, the more that we can make ourselves more fit as best as we can be before we go through these treatments. Uh, the less damage that we are intaking from the treatment itself, and the faster recovery rates that we have.
Amazing. I love the analogies actually because it makes it so clear. So I'm going to steal some of them to use with my patients, if that's okay.
You No, it took me forever to think about that, because ultimately, at the end of the day, I want to make this easy to understand for our patients. I mean, because the stuff is great out there, but it's like, okay, but how we decipher as how we decipher that information to the people, then, when they can make that connection with it, they can really understand just the true importance of, like, okay, I got to get exercise now before I go in for my treatment.
Okay. Yeah. That's a really fair point and so important. And um, so we'll continue talking about different stages. And I was thinking about now about more of the treatment period. When I talk about treatment, not so much surgery, but chemotherapy, radiotherapy. We know that physical exercise and physical activity has such an important role in preventing side effects or improving side effects. And what's your experience with that, Chris?
Yeah. So, when for example, when we look at radiation treatment, when we look at chemotherapy, I I tend to you think when I'm working with patients undergoing each of those different treatments, or unfortunately in some cases both of them at the same time. I'm already thinking in my head, okay, if they're going through some type of chemo regimen, they're going to have some strong systemic total body response to the treatment itself. So, of course, there's the physical aspect of of pain and fatigue, and the neuropathy that comes in. But then also, you know, um, we hear about the cases of chemo brain. So like their cognitive factors are affected, their memory. So and especially depending on the type of chemo treatment, the dosage cycle that they're going on, will give me an idea of the robustness of the effects of that they could be experiencing. And of course, it comes back to the individual. Some people, they can go through a very aggressive regimen, but maybe for the first couple of weeks, they're perfectly fine. So depending depending on all of those like factors, I definitely take that into consideration when I'm working with the individual. When the individual is going through radiation treatment, typically in my experience, it's more of the whatever area is affected. It tends to be more localized for that area. Not always, but but the area of the body of where the tumor is located, that that area may be affected, and everywhere else with the body may be fine. But keeping in mind, maybe there is some fibrosis that's going on. Maybe there's um, more pain because of the burns that may be associated with the radiation as well, or maybe there is numbness or tingling, with all of that. But it really depends on, of course, the individual and just the treatment um, itself, but also, you know, um, even even with those factors in mind, if the individual is doing everything to the best of their ability in terms of keeping themselves healthy, despite those treatments themselves, they tend to, whether it's radiation treatment or even chemotherapy, they tend to tolerate them better. So so whether if I'm working with the individual while they're going through the treatments or shortly after um, the treatments, the good thing I know is like when they go into integrative cancer services, as far as improving their diet or just all of their lifestyle factors altogether. I already have a good idea that, depending on what issues or side effects that they're going through the treatment, things are going to get better as time goes on. Of course, there's usually those cases that don't, but in my experience, the majority of the cases that I've ever dealt with, they do get better over time.
Right. And you touched on such important issues of, having a multidisciplinary team approach in which you're in contact with or other health professionals that actually all working together to improve the quality of life of that particular patient. So yeah, that's brilliant. And so just giving you an example that I find it's quite frequent in clinical practice as well. Let's say I was diagnosed with cancer and I'm going through treatment, which actually happened to me, and I'm experiencing like extreme fatigue. How do we bring someone who, let's say, never exercised before or doesn't know the importance of exercise to actually start sort of an exercise regimen in such a delicate and vulnerable time in which actually they don't feel like moving or something like that? And I know you have the health coaching background, which uh, perhaps it's useful on that as well. So I'm interested to hear your thoughts.
Absolutely. No, and you bring up a very, very great point. And I mean, and just your story alone is absolutely incredible. So when I first heard about you and, came across this podcast, I was honored to be talking to somebody like you. Thank you for sharing that. But yeah, what you just said there is a very, very, very important on topic. I mean, just not just for the for my discipline, when it comes to working with cancer survivors, even for others, because usually, like you said, in that most vulnerable time for those given individuals, the priority need for certain therapies or services may be much lower than, just the compared to the treatment itself or the operation or whatever it is. And with that said, exercise oncology, for example, for a lot of patients that I've dealt with, that not all of them, because there are some of them who do value exercise, especially from the get go. But for a lot of people, they don't, or they don't at this time, or they want to do it later, So when I'm working with those individuals, um, I immediately try to find the opportunity to for them to get them to understand what exactly I do. It's not all about exercise, really. It's all about managing, for example, how much sedentary behavior you're getting in your lifestyle. So I tell people, for example, this just two sides of the coin here. When it comes to um, just the movement itself. There is movement itself, then there's lack of movement. Um, and I tell them, look, if you don't want to exercise right now, or if we don't want to find ways of getting more movement, let's try to find ways, for example, of how we can limit our sedentary behavior. How do we do that? Breaking up those long periods of sitting down in a chair or in a bed. Um, um, for long periods at a time. If we break up those long periods at a time, that's a big win right there. And, when we limit our sedentary behavior, for example, we create the opportunity and the capacity to be able to move around better and to exercise. So most people when I work with, they tend to think of like when um, you know, here I am going back to those analogies again. When they look at exercise, they look at it like exercise is this big old mountain. And in order for exercise to count for them to do, they always have to climb that mountain, like that same height, under that same amount of time. It has to be this much in order to quantify as good enough exercise for them. And I tell them, assuming if that's the concern, that's not the case here. There's many different ways of how we can do it. It doesn't even have to be for an hour or 30 minutes like you think. It can be for 30 seconds, or it can be, for example, sure, if 10 minutes of walking is easy for you for this week, but let's just say you can only do it for 30 seconds the following week because you're going through your um the side effects of the chemo treatment and whatnot. uh I would say, for example, way, look, if you weren't going through that chemo regimen, that 30 seconds of walking that you could only do now, you would have been able to do like 10 minutes or 30 minutes or even more. So I always tell people, you can't really put a perfect number with all of this, And I always tell people, look, and even if you can't do any exercise at like say intent, I'm at least gonna. And sometimes, even when you set the intention, it doesn't work. You can always try again the next day. But as long as the person is driven, not just motivated, but driven to set the intention that I'm gonna do something, you know, the exercise or move more or limit the sedentary behavior, then it's eventually gonna happen. And that's what I try to lay out for the individual in terms of getting them to understand the whole platform of exercise oncology of what it's all about. I try to get them to understand that entire aspect of it, so they feel much better to pursue what they're going forwards.
Yeah, absolutely. And you touched on so many different points, and just you can start slow. You can do it 30 seconds a day. You can do so many things, but also there's so many types of different movement, right? Like I know there's some evidence with dance, for example, and even walking, meditation, and all these different activities that could actually be very interesting for someone who doesn't really like physical exercise in the standard way. So, yeah, and I'm sure I know you're familiar with that. Um, I was wondering also if you think, and you've touched on that when we discussed some of the issues before, but I was wondering if there is some contraindications for physical exercise, which is absolutely different from physical activity or some form of movement. But can we or can you work around someone's limitations, or sometimes well, we can't actually for having a what we consider standard exercise regimen?
Yeah, no, I know. I mean, that's another key point there. Um, we can work around different contraindications. It's usually the type of movement that we're doing, and the intensity. It is, so of course, one big contraindication to exercise is pain. Like for example, so the pain is too severe, then absolutely, exercise is not the right thing to do. Like, let's just say for resistance training, they absolutely cannot do. But let's say the person can tolerate, and when I say tolerate, this is assuming that certain things are cleared by the doctor. Like, okay, maybe they can move around and do things. They can do lighter forms of movement. Or maybe if they can't do strength training, maybe they can stretch certain extremities of their arms, or certain areas of their arms or legs, where something is much more tolerable, and it doesn't conflict with the affected area. Some contraindications in regards to cancer, like for some people, they're they may have a very low white blood cell count, for example. So maybe, of course, they're in the bed, maybe they're not up and moving around, but maybe they can do certain wrist movements or ankle movements in the bed, enough to not um, to overburden their immune system already, but maybe just enough to get them to feel better, or just to loosen up maybe some sickness that they may have, or just to improve upon their overall well-being, like to some degree. Um, so depending on what it is, you know, we can usually work around certain things. But like, say if they're coming out of an operation, then yeah, absolutely not. Like maybe for the first like week or so, they don't do anything. They have to recover. But of course, this is dictated upon um their doctor. But if they're already doing some type of functioning like throughout the day, that's usually a good sign that they can do some type of physical activity.
Right, brilliant. And that goes for I'm thinking about bone metastases as well, for example. That's a big thing that we're asked constantly. So there's ways around limitations, and of course these ways are not always the same. It depends on the person, but there's ways that people can still move despite their conditions.
Right. I mean, and coming back to the sedentary behavior component, if they can absolutely not do any type of exercise or movement, then I focus on the context. Okay, what can we do to attack the sedentary behavior?
Right.
And if they absolutely can't do anything at all, uh, in the cases that I've worked with, it's usually for a very short period. And what I mean by for a very short period, maybe after a couple of days, they can do some type of movement, like in the bed, of course. And that's the case. And of course, if they're already doing something like that, they're usually working with a physical therapist or somebody in the rehabilitation field aspect of it.
Right, right. And I was wondering because we're talking about exercise in cancer, and one question that we get a lot is what type of exercise, and I'm sure it depends, but there's so many types of exercise. Like you can go a bit more cardio, you can go strength training or resistance training. There's also forms of uh, mm, training your balance, for example. So how do you assess that for a given person? Do you try to offer all these different modalities? Is there one that has more evidence over the other? Yeah, all these different questions.
Going back to my analogies again, I look at exercise like a fruit basket. It's like when we eat all the different fruits, each different fruits or even vegetables, of course, they have their own specific nutrients that maybe another fruit or vegetable won't have. So, as best as as I can, I always try to encourage the individual to do all different aspects of the different exercise. When we're talking about physical fitness, we're talking about that realm of muscle strength, muscle endurance, cardiorespiratory fitness, um, flexibility, even proponents like with balance or power, speed. That's more of on the secondary stuff, but like the primary aspects of it is the cardiovascular, the strength, and the flexibility with the balance. Um, either one of them is great, but when we typically combine it with another form of type of exercise, you're going to get more additional benefits. It's like, for example, when we combine the aerobic training with the resistance training, especially in conjunction if we're trying to lose weight. Of course, the aerobic training is going to improve upon our stamina to recover and to do things longer and to utilize oxygen more effectively in that regard. But then when it comes to the resistance training, the resistance training increases more muscle mass. More muscle mass is going to have a positive improvement in terms of our metabolism. So we're going to be expending more calories at rest. So in conjunction with those two different modes of exercise, you're going to typically see better results with that as opposed to doing one or the other. And you actually, it's kind of funny. You actually touched upon it too, like walking meditation. I've been seeing some studies out there when you combine mindfulness or meditation, like with the walking, you're getting even more benefits. You're getting even more mental benefits, or the psychological benefits, as compared to just walking alone. And there's a lot of correlation on what walking meditation does for cancer prevention, um, diabetes prevention, and I forget what the other one is, but I'm pretty sure it does a lot for the other conditions out there too. So um, I always say more in the more inclusion of different types of exercises, the better. But ultimately, something is always better than nothing. So it's like if you can't do more than one thing, hey, I'll take it. Like doing something in some regard is always going to work out regardless.
Okay, yeah. Absolutely. And a bit of a technical question, but I think it's important to actually convey the why is it important to actually have an exercise or some form of movement in when we're going through a cancer condition. And why is it different? So we talk about a lot. We talk about the loss of muscle mass in cancer, and why is this condition different than the loss of muscle mass as we age or as pure deconditioning? What happens in cancer that it's actually uh, more essential that we intervene?
No, that's a great question, and there's a lot of research on just delving into that area. In the area of cancer, the loss of um, muscle mass in that area, there's a stronger tie to mortality. So because recently our muscles have um, it's an endocrine or organ, believe it or not. It produces micro RNAs and exerkines. Like when we contract our muscles, we elicit and release various activators in our body, messengers in our body that allows for our organs to crosstalk with each other. So in the context of cancer, when we lose muscle, we basically lose more of that ability for that, and we further open the door for other complications to happen. And coming back to the that castle analogy, it's almost like the not only the castle is too weak to deal with the blows from the enemy, but even blows from the treatment itself. Like a lot of, especially for our Asian population, when they have lost a lot of muscle mass, there's various cancer treatments that's would still work for them. But then, the oncologist looks at this individual and say, if I put this person on this regimen, it's going to kill them. Their body is not strong enough. Their body is not strong enough to tolerate the blows from this treatment, and it just further limits the choices of what can be done for that individual. So that's why when I look at muscle loss, especially for our cancer survivors, that's like a double whammy in comparison just to muscle loss for somebody who's aging. And of course,
Yeah.
that's bad too, but obviously much worse for the cancer survivor or the person.
Yeah, and I mean, when the castle is not strong enough, as you say, like decreasing chemotherapy doses, for example, is actually quite frequent that we have to do that. So it's a matter of using exercise to our advantage as well to withstand treatment. So it's a great ally on that as well. You're absolutely right. Um, I would like to shift to survivorship now. And one of the questions we get a lot in terms of exercise is the many people have fears of carrying weights when they have lymphedema. Exercise is indicated um, in that particular condition. What can you tell us about that?
I apologize. I don't know if it was a connection, but I want to say you kind of broke up there, like just for like 10 seconds. Sorry, I
Okay,
didn't
I'm
get the
sorry.
question. Sorry about that.
No, I'm sorry. I was saying that some people are fearful of doing some weight-bearing exercises when they have lymphedema. And would you have some insights on that?
Absolutely. Short answer is if you have lymphedema, exercise, strength training specifically is one of the best things you can do. Is part of the guidelines for people living with lymphedema, and that kind of ties into my example. Well, actually, no, you alluded to it. Oh my gosh, if we knew this 10 years ago, I mean, we would be in a much better place. And actually, it's kind of funny. Back in 2010, where I believe the very first exercise guidelines came out for cancer, I call that the renaissance for exercise oncology, because ever since after that time period, or just the release of that document, it's a surge of more randomized clinical trials this would soon follow, and they just kind of went in their individual focus, and it's still going on, and it's still it's still kind of like a time of enlightenment in terms of like the renaissance of
Right.
for exercise on oncology. But to get back to what you're saying, sorry for going off in that tangent.
That's fine.
Um, you know, um, you go back, you probably maybe even 10 years ago, or definitely before that, it would have been discouraged, or there just been more concern for somebody with lymphedema, for example, to engage um in exercise, especially for their upper body, depending on where the lymphedema is, but in most cases it's typically going to be um the arms. But um but of course, it still depends on, the nature uh, of the surgery itself, like how much lymph nodes like were removed, like, how did the person recover for that. But resistance training, for example, it serves as a platform similar to what massage therapy does. It helps to shunt that fluid out of the affected area. If it's tailored in the right way, that's the thing. It has to be tailored in the right way, and typically, the progression needs to be slow. It's just not like, oh, bam, all this resistance training all at once. No, that's in the cases where it would be bad, and that's probably, maybe you go back so many years ago, of like maybe back then why it probably did get a bad rep, because maybe that's what was done. I mean, I'm only making that assumption, but um, as long as the the weight is light, for example, whether it's light dumbbells or elastic bands, and the progression is very, very, very slow, the uh, dealing with the issues with lymphedema will typically go away more smoother in comparison if the person didn't do any exercise at all. And there's different studies that tend to that actually show that. So and that's what I mean. We're the fact that we're understanding all the amazing benefits with exercise. We're now understanding like things that like, oh wow, um we used to say don't do this, but do it. The exercise is great.
Yeah.
Do it.
Yeah.
That's the thing you need to do.
Yeah, absolutely. And we do have many health professionals saying don't move during cancer treatment. So it's actually a challenge. And it's so important to talk about these issues to actually open further these conversations. Um, I also find very interesting. So, survivorship is quite a big world. Obviously, we have people who are just, doing these tests and just making sure everything is fine and okay. And also, we have people living with cancer for a long time and going into palliative care. Uh, do you so I was wondering if you could speak a little bit about the benefits of exercise in that stage, even when I have an incurable disease. Um, can I still exercise? Do I have benefits in exercising?
That's a great question, and to that regard, I'm assuming, you know, the research is still developing in that area, in terms of, when it comes to survivorship, and definitely people with incurable states of cancer. Um, you know, um, of course, when there's a situation where there's a lot of question marks, like does it work or not. I always encourage, I'm not saying it, but I always encourage if we don't know the answers yet, it never hurts to try, So um, I personally believe that f- for those given for those individuals who are in scenarios like that, they will still find some benefit. They will find um, benefits or a benefit with exercise in the given scenario that they're in. Um, maybe something with the anxiety or some type of tension or maybe better mind body connection. In a given state like that. Um, that's personally something I don't know too much in regards in terms of um, those individuals, but I definitely do encourage that even in those given scenarios that they should be or the people that they're working with or caregivers should always encourage some type of movement, some type of activity because, and I know you know this, but even if the doctor makes a decision or if they make a determination, at times, there's sometimes maybe the doctor or for that given condition, there might be an error. Maybe there's a surprise. I mean, I do believe in miracles in some given cases where, and I do know personally some people with pancreatic cancer who are predicted not to live longer than 2 years. They've rose above the situation, for the given circumstances, and they're doing great, like today. So
Right.
even in those scenarios where they're in palliative care or close to it, to where they're still functioning, there's um, there's still a possibility. I always say there's still a possibility. If you're
Yep.
breathing and you have some type of control in your life, there is some possibility, and we should at least always try to make that effort.
Yeah, absolutely. Absolutely. Um, all right. And I would like to also ask you a question about the circadian rhythm because, exercise is, it's, as you said before, it's a piece of so many different interventions that could have benefits in cancer patients. And, when we walk after a meal or when we do some exercise after a meal, that has an impact on our glycemic control and when but also it's a great a regulator of the circadian rhythm. And so I guess my question is, can we work around the hours we exercise and um, have it to our advantage, basically?
Absolutely, absolutely. I mean, I look at circadian rhythm it's like sleep. Our body naturally likes balance. So, with that said, when it comes to diet and exercise, we definitely want to be cognizant of, okay, if we eat at this certain time or if we exercise at this certain time, it's not going to conflict with it's not going to conflict with one of the time periods of the circadian rhythm, preferably recovery, especially when during the evening hours. If we are going to exercise, for example, close to the evening, I always like to think of like, okay, if we're going to exercise, maybe we just don't and of course, that depends on the individual. Some people, for example, they can tolerate vigorous exercise in the evening hours, and they will fall asleep like a baby. But then there's other people, they do something like vigorous exercise in regards to circadian rhythm, where their catecholamines are still elevated. They're trying to go to sleep or something. Sometimes I'll see these people in the gym late, and then, I'll talk to them the next day and they'll say, yeah, I didn't sleep good. I'm like, well, I mean, you're doing 5 sets of squat with 400 pounds on the bar. I mean, I can only imagine. I mean, your blood pressure, your heart rate, adrenaline levels, you're probably way up
Well,
the roof. You know, so just but so in respects to that, I always encourage people, when you are doing these given things, it's not going to interfere with your circadian rhythm because, you know, um, I look at your circadian rhythm or recovery, for example, like it's n- like an investment. Like you want to let those benefits accrue. You want things to work efficiently. You want your systems to work to their best of their ability. Not halfway to their ability. So, by combining um, proper lifestyle while proper timing in conjunction to your circadian rhythm, you can really, really improve some great outcomes like in the future, especially when it comes to weight, for example.
great. Yeah, absolutely. Thank you so much. We're kind of coming to the end of our time together, but I would also like to ask you, is there anything you would like to say to conclude? Anything you wasn't mentioned that you think is important? Any message you want to leave?
Absolutely. Well, first of all, no, thank you so much for having me on here. I really appreciate having the opportunity to just to explain exercise is medicine and yeah, that's the thing. I'm very grateful to work in a field where something has a lot of great evidence and if the world you know improves upon this, a lot of big problems that we are facing in today's age will be reduced and just for anybody viewing this podcast or this episode is exercise doesn't have to be hard. It can be very, very easy and it can be fun too. Just focus on the things that you enjoy doing in your life and in terms of how you function throughout the day, and then turn that into exercise and turn that as your way of living a healthy life. So just make it fun, make it easy.
Mm. Thank you. Thank you, Chris. Make it fun, make it easier. Thank you so much for coming on the podcast. Thank you all for listening, and I'll see you next time.
Thank you.